Imagine yourself seeing a therapist. Now imagine seeing one with an interpreter. It would seem obvious that seeing a therapist with an interpreter is not nearly as preferable as seeing one who communicates directly and fluently in your language. The therapist-client relationship is extremely intimate and concerns the client's most private thoughts and feelings. Having an interpreter involved in that process, no matter how skilled and experienced the interpreter, can inhibit the process. The therapist may rely too heavily on the interpreter for cues about the client's emotional state. The interpreter may be asked to do things that the therapist is responsible for. Therapists may spend a lot of time in sessions just getting used to working with an interpreter. So can therapy with an interpreter work? The short answer is yes, but it requires three things. A client who wants to change and work on their issues, a therapist who respects deaf culture and ASL and takes the time to study and prepare for working with a deaf client and an interpreter who recognizes the complexity of the mental health setting and takes the time to learn about it. Many interpreters work in the field of mental health without the benefit of understanding the unique interpersonal communication dynamics at work. This article explores some aspects of interpreting with mental health professionals and clients in therapy. The goal of psychotherapy is for the client to work through interpersonal problems with the therapist. At some point in the process, the therapist might come to represent significant people from the client's past, and the client might react to the therapist in the same way she or he would have reacted to these people. When these transference reactions occur, the emotional level can be very intense. Anger, fear, shame, embarrassment, and humiliation are just a few of these feelings that may accompany this reaction. Therapists are trained to set the stage for these feelings to come up for the client and to work with them. Therapists connect on an emotional level with their clients to help them find new ways to cope with whatever their problem might be. Clients bring into the therapy process all of the aspects of their personality that they display in their other relationships. Thus, whatever goes on in one's therapy can be looked at as similar to what goes on in one's life outside of therapy. By extrapolation, then, therapy with an interpreter will definitely be affected by the client's attitudes about and experiences with interpreters. The client brings attitudes experiences, negative and positive, and certain expectations, realistic or not, about interpreting and how interpreters should behave.